So, what is the Freehold Area Health Department doing with the podcast? We want to share with you the amazing work that local health departments do while sharing some of the outrageous true stories regarding the antics of our daily work. We're changing up the host, the guests, and the topics because we want to keep it fun and interesting. Let's learn what Freehold Area Health Department does. Hello there, and welcome back to our podcast, What the Health? I am Margie Yan, the health officer for the Freehold Area Health Department, and I'm happy that you have joined us. Today, we're going to talk about childhood lead poisoning, something that I am sure that most people know very little about. We're going to talk about what causes lead poisoning and how we manage it, while our expert guests share a few of their stories on how local health departments become involved in cases and why it is so important that we do. To me, preventing childhood lead poisoning is one of the most vital responsibilities that public health undertakes. Managing and preventing bad outcomes is crucial to making a difference in a child's life. So are you ready to learn something new? Let's dive into the good, the bad, and the ugly with childhood lead poisoning prevention. Today, we have three guests, two public health nurses, Krista Moore from the Freehold Health Department and Leonora Janowski from the VNA Health Group. And we also have our expert, registered environmental health specialist, Maggie Carl, who also happens to be a certified lead inspector risk assessor. Welcome, ladies.
Hi,
Let's
Margie.
talk about
Hello.
childhood lead poisoning prevention. I'll start with you, Krista. Can you just tell us a little bit about what lead poisoning is and why we are concerned about it?
Sure. So lead is a heavy metal. It's found in lots of different things. Most people are familiar with lead because of lead paint. So before 1978, it was really normal for lead to be in paint products. So if you've ever been in a building or a home built before 1978, odds are there's lead paint on those walls. But lead's in a lot of other things as well that people don't realize. So things like dirt, soil, water, some candies, spices, candies and products from other countries, cultural products, pottery, ceramics. The list really kind of goes on and on. So it's in a lot of places. And the reason we are concerned about lead is because it is a neurotoxin. So it is bad for brains, specifically tiny developing brains in children. So we don't want children to be exposed to lead because it can cause a lot of health issues for them. Things like slowed brain development, slowed growth, developmental delays, hearing problems, speech problems, learning problems, behavior problems, a whole list of things. And those problems can follow kids into their later life if we don't address it early. So it can cause things like lower IQ, harder to pay attention in school and in work, and even poor impulse control. So we know that lead is bad. We know when kids are exposed to it, it's bad for them, and it can cause a lot of health problems. So that's why we care about lead.
So I guess if we're concerned about lead in children, how do we find out if a child is lead poisoned or not?
Yeah, so the thing with lead poisoning is most kids aren't going to have any obvious signs or symptoms. It's not something that you can look and know that a child has lead poisoning. So we need to test kids. And the way we do that is with a blood test. It could be a finger stick done in your pediatrician's office. It could be a blood draw done at a lab. But we need to check their blood to see if there's lead in them. In New Jersey, we do have a law. So all children should be tested at ages 1 and 2. And if they miss those screenings for some reason, we want them tested at least once before they turn age 6. So the reason that we test at that age, couple things. Like I said, lead is really bad for developing brains, and 1 and 2-year-olds are growing and developing so quickly, it's the most detrimental to them. And also, if you've ever spent time with a 1 or a 2-year-old, you know everything goes in the mouth. Automatically,
Right.
Everything.
Right.
So
Yeah.
that's oftentimes how kids that age get exposed. So that's why we test at those ages.
That makes a lot of sense. As far as being a public health nurse, and we're talking about how public health gets involved in lead poisoning prevention, do you have an opportunity to do any screening? Do we do any screening?
We do. So this was new to me when I started. I had never worked with kids as a nurse before, and then I came to the Freehold Area Health Department, and one of the things we do here is childhood lead testing, which has been a whole new learning experience, and I do love it. It took me some time to get used to working with that population, though. But yes, we can do lead screening here at the health department. You will often see us actually out at community events. We partner with our WIC clinic through the VNA to do testing at their location. We do a finger stick, so it's a little capillary stick. We get a result in 3 minutes. If it is low, normal, child is good, screening is done. If it's elevated, we will send them for a follow-up venous blood draw just to confirm it truly is high. Really, we want kids to get screened when they see their pediatrician, right, as part of like their normal childhood well visits, because they get lots of other things at that time too. But sometimes kids fall through the cracks. They miss those screenings for any variety of reason, a lapse in health insurance, transitioning between doctors, maybe they're a new arrival from another country. So we're really here to kind of catch those kids who might have missed that normal screening.
Okay. So Leonora is our primary nurse case manager, and I guess wanted to throw a question to you. So once we're notified that a child is lead poisoned, and that does come in, I don't know if Krista had mentioned, but we do get notification by computer that there's an elevated case. Is there a treatment for these children? What happens typically?
Typically, the first treatment is finding the source. If the source is candies, certain foods and spices, things like that, that's easy. We tell the parents to discontinue that. If the source is paint chips from the house, what we do is we encourage very frequent hand washing of the children before they eat, before going to bed, after playing outside. We encourage the family to do a lot of cleaning in the home, damp dusting, not dry dusting, because that just pushes the dirt and around the dust. We encourage frequent mopping. We encourage diet high in vitamin C, calcium, and iron. Those three help slow the absorption of lead in the body.
So what is the range typically that we see, like from a low, and I know we talked about an action level, and I don't want to get into specifics of the numbers, but is there like low kind of exposure and then super high exposures? And if there are high exposures, what type of treatment could they get besides just the education and the cleaning of the home? And
most of the cases we see are, that's the treatment that we would use, but we do occasionally get a high level. When the level is that high, the child will be hospitalized for chelation, which is when the child receives a medication that will bind with the lead in the body, and then it will be released through their urine. And that's basically to get the lead level down quickly because of the effects it has on the brain.
Yeah. So do you just make one visit? I mean, how many times do you typically see a family while you're managing a lead?
It's all different. It all depends, but we do the case management. We do a lot of phone call follow-up as well.
All right. Are you willing to share a particular story of maybe something that, maybe a particular case that was just kind of unusual, very high, elevated blood leads, and the importance of us getting involved?
Sure. We had one case, it was a 2-year-old. Her family, grandparents came from Colombia to visit, and grandfather was a fisherman, and he brought her a beautiful handmade fishing net that had fishing lures on the end. And this child was playing with this fishing net for a couple of days. It just so happened that her 2-year-old checkup was coming up. She went in for her physical, and the doctor for 2 years did a blood test check for lead poisoning, and her level was extremely, extremely high. She was immediately sent to the hospital. She was in the hospital for about 10 days getting chelation to get the level to come down.
And were they able to get it to come down?
The level did come down. She's still being treated today, but it did come down.
So it's
significantly.
Yeah, it's scary when you know that the lead has such a effect on the development of the brain, and a 2-year-old having super high lead levels, and then just the amount of time it takes to come down from even after chelation it's amazing. So that story didn't involve paint hazards. Krista had mentioned that a lot of times paint, that typically is more likely. Can you share a story about a particularly high or an interesting story about working with a family with high paint lead poisoning?
Sure. We see a lot of the cases are from paint chips. We see children's cribs next to a wall next to a windowsill, and the children will put their mouth on the windowsill and start biting on the windowsill. We've had cases where toy boxes were under the windowsill where there were paint chips, so the chips would be falling into the toy box, and of course the children putting everything in their mouth. we see that a lot.
It's bad. So I think, really what I want to emphasize to you all that it's important that we do get involved because families don't know. And they need that little bit of education to understand how vulnerable their children can be. So I appreciate you sharing a couple of your stories with us. Maggie, not to forget about you, can you tell us a little bit about what you do when it comes to childhood lead poisoning issues?
Sure. So, excuse me, as a lead inspector risk assessor, there's two parts to that, the lead inspector and the risk assessor. A lead inspector will go with an XRF, which I will show you momentarily, and kind of do a surface by surface test for lead-based paint using the XRF. The risk assessor portion is more hazards. What kind of hazards are in the area? Is it paint? Is it paint? Is it soil? Is
Outside.
it, anything? It could be anything, literally.
The child could potentially, like if the child's
Right.
playing outside, we'd want to look at
We would
the
want to
lead
look at the
content.
soil.
Right. Or on the
Um,
deck if the paint is
If the
peeling.
paint is chipping on
Yeah.
the deck, we're definitely going to test that as well. You're just kind of getting an idea. Is the paint deteriorated? Is it not deteriorated? We kind of look at a bunch of stuff. We also test for lead dust on floors and sills.
So when you open and close doors, sometimes the dust will
There's
fall
a friction surface.
Right,
Yeah.
okay.
And that friction surface creates dust. It falls to the ground. And as children play, they're putting their hands in their mouth, and that's how the dust gets in their mouth.
So let's say you find lead in a home and you find it in a couple of rooms, usually along the windowsills, maybe outside on the deck and whatnot. What do you do then? Is you just say, "Hi, you've got lead in your house. Thank you very much," and walk away? Which I don't. So I'm leading the witness here.
If we find lead in the house, lead-based paint primarily, what we do is we put it in a notice of violation. That notice of violation goes to the homeowner and the family, and it just spells out where we found lead and what needs to be addressed.
So they have to clean
They
it
have
up.
to address it, yes.
And oftentimes, I'm going to say that we have landlords, right, who end up having to get involved, and they're not very happy about having to clean up the lead in the home.
It's very expensive. Yes, they're not happy. But it's a necessity.
Can the homeowner do it themselves?
A homeowner can do it themselves if they live there. If it's a rental, they cannot do
So
it
the
themselves.
landlord can't
The
bring in
landlord
his own,
cannot.
and he has to have a certified
Abatement company.
abatement company to manage the abatement. And can you give me an approximate cost of how much that would be?
I don't really get involved in costs, but depending on the area involved, it could be 15 to 50,000.
50,000, right? It's a wide range.
It depends, but it's pretty expensive. And the abatement companies need a license, they need training, so it's
Understood.
They have a lot of work
There's
to
a
do.
lot.
Yeah.
Yeah, no, it's important. Can you share a case investigation that surprised you or left a memorable impression on you with your job? So just to kind of better explain, so the nurse does the contact and management with the children and the family and the education, and Maggie handles the environmental aspect. And so I'm asking her if she can share a story that maybe something that stuck out in your mind about something that you found while doing the environmental inspection.
Sure. So, as part of the inspection, we go surface by surface. And when, in one case, particular, we were looking at the windows, and to get the sash down, we had to test it, and we had to move the window down. And the lead paint chips, it was so deteriorated that the paint chips were just falling to the floor like snow.
Wow.
And you look on the floor, and there are paint chips there. That's why vacuuming, keeping paint intact is so important. In that same house, we also saw bite marks on the windowsill, I believe. So that was paint chips and biting on the windowsill. We all know lead-based paint can be a little sweet. That could be part of it. So, yeah, those were very memorable.
Yeah, if you can picture then being in a household and not keeping the floors mopped and cleaned, and then we've got a bunch of paint chips on the floor, and as again the 2-year-old, the 1-year-old with everything that goes in their mouths to explore and learn about their world, they're ingesting lead, and the more they ingest, the more they want to ingest, because again there's a sweet kind of flavor to it or taste to it that makes them want to come back for more. So thank you for sharing. Now, I did ask you to bring in your XRF.
I did.
So the XRF is the machine that we use to actually identify the lead on the home. And I just asked Mag if she could do a little demo for our audience today, just to kind of give you an idea. I do have one question. Is it heavy? The old ones used to be really heavy.
It's lighter than the old ones, which helps. Not to get into specifics, but this has, when you hold it up to a wall, we get a response pretty quickly with this one. The old one, it could take like a minute if it gets old, and of course, you know, my arms get really tired.
Right. Well,
so this one's very quick. It's not that heavy.
Can you show us how you hold it? I mean,
yeah. You hold it like this. You do have to calibrate it beforehand, which I've already done because it can take some time. You'll see a green light. That means there's no radiation right now. It is an XRF, that's X-ray fluorescence, so there is some radiation involved. So you never want to point it at anybody or, you know, through a wall if somebody else is on the other side.
I learned that when I went with you the very first time, and you're like, you need to move out of the way. I was like, oh, okay, this is intense.
it will go through you, but that's not a good thing.
No.
So what I brought today, I don't think there's any lead paint in our building. So this is a sample that we use to calibrate. And there is a 1.03 milligrams per centimeter squared lead square here. Anything over 1.0 is positive. So we'll see what we get. So this green will change to red if it's creating radiation. So once it's red, watch out, don't get in front of it. So I'm just gonna take a test on that one. Sure what's going on.
It's red.
The closer it is to 1.0, the longer it takes because it wants to be sure. So this came out positive at 1.0. I don't know if you guys can see that orange right there. That means it's positive. If it was negative, it would be green. And that's pretty much how it works.
Cool.
Surface
So
by surface.
you get to play with toys during the day.
Yes, we do.
That's pretty good. Nurses play with needles, and you get to play with an RXF gun. I kind of like that. So, okay, I want to thank my guest for coming today. Thank you for sharing your thoughts and your wisdom and your expertise. Appreciate it and hope to have you on again sometime. Thank you. That's all we have for today. I hope you found this interesting and learned something new. Public health is always there working to prevent bad outcomes, things you don't even know that are being done. We hope to see you soon for our next episode. Stay well.